Were you always confident that you would meet it?
It was a stretch target, and a lot of things had to go right for us to actually meet the target. And you could see by how close it was. We were sort of about 24 hours, maybe early, but lots of things could have happened that would have derailed us. So I'm grateful both on the supply side to both Pfizer and Oxford AstraZeneca, and of course the deployment side. We have an incredible team of NHS leaders, as well as, of course, the military and the army of volunteers. The private sector, the back-end distribution is done by the back end of Boots and Superdrug, and the front is DHL. So this is a collaboration of the best of the United Kingdom coming together to deliver what I think is, I know it's the largest deployment, civil deployment certainly, since the Second World War, and it's the largest vaccination program in the history of this country.
Right, I've got lots of questions I could ask you, but I really want to devote this hour to the questions that listeners have. So let's crack on. Jenny is in Camden. Hi, Jenny.
Hi, I'm a teacher, and I wanted to ask: are teachers and school staff going to be prioritised for the vaccine, considering we'll be going back to work?
Hi, Jenny. So at the moment, Jenny, we're going through the phase 1, which is set for us by the scientists, the Joint Committee on Vaccination and Immunisation. They looked at lots of evidence on professions, teachers, police officers and others. And of course, they also looked at people of ethnic background, BAME background and others. And they fell very clearly on the side of the clinical need is age. And of course, in category 6, which we've just entered now, obviously we're doing 5 and 6 now. Category 6 is 16-year-olds up to 65-year-olds who have any underlying conditions that would put them at high risk can now come forward. So teachers who for, whether they have respiratory problems or heart issues or lots of other underlying problems can come forward and be vaccinated now. Once we finish phase 1, which is the 1 to 9, so some teachers will be over 50, which is category 9, then we'll move to phase 2. And we are asking the question of the Joint Committee for Vaccination and Immunisation as to whether we should move to a different prioritisation. So should we have people who, through their work, like teachers, like police officers, like shop workers and others, may come into contact with other people and, of course, much greater volume of the virus. And they will look at that and advise us accordingly. At the moment, we're going through the phase 1, which will be 1 to 9 by end of April. We'd have given a first dose to all 1 to 9. And, of course, second doses for those who will then be due their second dose as well.
Jenny?
So basically, no. The short answer would be no. We're prioritising other people, and I agree. People who are working on the front line in all sectors of society. But if you look at schools are such a highly politicised issue, and we as teachers have been completely shone by a huge section of public. The government is turning around and telling us that we have to lose holiday. The morale and motivation is very, very low. And then on top of that, we're going back into a situation where it's not clear that our contact is, we're going to be at risk of infecting other people or getting it ourselves. I mean, you can't have it all ways. Teachers aren't just automatons. We need to be taken care of.
Absolutely, Jenny. And I want to thank all the teachers who, by the way, have kept schools open, both primary and secondary, because they are teaching the children of the front line of healthcare workers who are looking after those with COVID, and of course vaccinating those who are most vulnerable and those who look after them. So I want to thank you for that. Any teacher who's in the category where they feel vulnerable to the virus from serious infection and hospitalization will be vaccinated in this category 6, which we are into now. And of course, anyone over 50. But we have to follow the clinical advice of the Joint Committee for Vaccination and Immunisation as to who is at highest risk of serious illness and hospitalisation and death. Because this is a race against death.
You say you have to follow them. You don't have to. I mean, I can understand why you are following them, but you are the ones in the end that make the decision. And there have been episodes during this pandemic where you haven't followed the advice of the scientific profession.
Well, I just think when the scientists say to you that these are the list of people who are most vulnerable, this is what you should vaccinate first, that is what is the right thing to do, in my view. If you look at the first cohort we've just done, which you mentioned in the opening of this phone-in, Ian, the 1 to 4 is 88% of mortality. 1 to 9 is 99% of mortality. So I think it's only right that we follow that. It's very hard to then say to someone, look, you can't have your vaccine because I'm going to vaccinate someone who's younger and fitter just because they happen to be in a particular profession. The JCVI have looked at that and they felt very clearly, and the evidence was very clear, that actually it was age-related and, of course, underlying ailments that people have, which is why we have it in category 4 and 6.
We've kind of got an allied question to this next with Alan in Fulham. Alan, hi, go ahead.
Hi. Good evening, Minister.
Good evening, Alan.
First of all, I'd like to obviously give my congratulations for the well done on the 15 million. That was absolutely superb going for the government. But from my own point of view, I'm an ex-police officer. I actually retired from the Metropolitan Police in September last year due to illness. Now, I also am a person who's vulnerable, and I have had my first vaccination. My partner is still a police officer. So the fact that my partner is out there working and coming back home to someone who is highly vulnerable to this disease, and my partner isn't getting any form of priority with regards to the vaccine, I can't see how that should be happening. I know at the end of the day, and we've already had a teacher say that they should get the vaccine. I'm now saying that the police should get the vaccine, but we are in a different situation. If you look at, I can only speak for London, and if you look at what's happening in the London NHS at this moment in time, ambulances are being driven by police officers. Those police officers aren't just driving the ambulances, they're also helping the ambulance crew. So they are frontline ambulance workers at this moment in time. If police officers come across something in the street and it's called up that an ambulance is requested, because the ambulance service know that the police are already on scene, the ambulance for our patient goes further and further down the line. So at the end of the day, we're doing the job of police officers, we're doing the job of paramedics, everything. So why shouldn't the police have that degree of priority?
Alan, thank you very much for your question. And the police have done an incredible job throughout this pandemic. And as I said, we've asked the question to the Joint Committee that in phase 2, should we be prioritising police officers, teachers, people who through their profession come into contact, much greater contact with much greater volumes of the virus. And they will come back to us. If someone like yourself who has had the first dose and therefore would have been in the top 4 cohorts, and if your partner carries out any form of sort of caring responsibilities, then they would be in category 6 as well, which we're about to start doing. But obviously, I haven't got enough details on your particular set of circumstances. But of course, if they themselves are either in category 6, which means they have underlying health conditions that will mean that they should be prioritised, then they will be picked up in this first phase. Or, of course, if they're over 50, they'll also be picked up in this first phase, which we aim to give the first dose to the over 50s by the end of April.
Alan?
The only unfortunate thing is, with regards to that, is you don't tend to have a lot of police officers who are in the category of high risk, because if they were high risk, they wouldn't be out doing frontline police work.
you've kind of answered your own question there, haven't you?
Well, I was just about to go on to something else. Yeah, well, something else that covers the same thing. We have, at this moment in time, as far as I'm led to believe, as far as I know, we have already had 4 police officers die from the Metropolitan Police, and 1 traffic police community support worker within the Metropolitan Police die. So that's 5 deaths within the Metropolitan Police. 1 death is too much. And if we've got the facility there to be able to help these people and stop that from happening, we should be doing it. At the end of the day, we only have 120,000 police officers in the whole of the UK. That's less than 1 day's vaccinations.
Sure, but any prison officer listening in will say, yeah, we've had quite a few prison officers die from COVID too. So, I mean, I hate to sort of set different professions against each other, but there are so many competing cases here for priority. Nadhim, is that a bit of a frustration to you, where you can see the perfect logic that Alan has put forward there, but then you could say, well, supermarket workers ought to be given a similar priority. As I say, prison officers, there are many, many other groups in society that could argue that they should be getting that priority. You say, well, it's for the JCVI to make these decisions, but you and your fellow ministers, Matt Hancock, Boris Johnson, etc., you'll all have your own views.
Well, yes, but you've got to rely on the clinical view as to the risk of hospitalisation and, of course, death, ultimately. And the JCVI are the best placed people because they are expert on the clinical outcomes for people to advise us on this, which is why we rely on them. But we are, Alan, asking the question in phase 2 as to whether we should prioritise, whether it's prison officers, police officers, shop workers, teachers, in that phase 2. You asked me how I feel about it, Iain. It makes me feel that I want to go even faster. If I can get more vaccine into the system, we've built a deployment infrastructure, whether it's hospital hubs, the primary care networks, the GPs, who are doing an amazing job, the national vaccination centres, the pharmacies. The faster I can get jabs in people's arms and protect them, the better it is for everyone, for the whole nation.
But is the key there getting the supply? Because I noticed that the daily numbers of vaccinations, range from somewhere 300,000 to 500,000. Yeah, if you were to draw a graph, you might think they'd be going up to 600,000, 700,000, 800,000 by now. Is that purely an issue of supply?
It is. The thing that determines the speed at which we can deploy vaccine is the supply, which is finite at the moment. You may have heard Simon Stevens, the chief executive of the NHS, tonight say that if you work out the numbers in the next 10 or 11 weeks, we have to double what we've done in this past 10 or 11 weeks. So because if you look at first dose to 5 to 9, which is 17 million people, and then of course second dose of all those who've had their first dose in the 1 to 4 categories, we are as long as we keep supply going, and I'm confident we can supply. It looks good. It's still finite, but it looks good. We can get to that target. It's 32 million people who have either first or second dose by end of April.
But is your nightmare scenario now that you have to stop issuing first doses because of supply, because you have to do these second doses within the 12 weeks?
No, we've got enough in the system to be able to. We're already reserving second dose to start doing that in March. And of course, we'll continue with first dose. It's a stretching target, no doubt. And if we can see more supply coming through, then we will keep going as fast as we can. But I think I'm confident, I should say, we can meet our target for the end of April, where we give the first phase a first dose. And of course, those who are then eligible for their second dose will get their second dose as well.
Okay. Right. We have lots of calls coming in. In fact, hundreds, if not thousands of calls coming in at the moment. So do keep trying if you don't get through. We'll come to more of your calls in a second. 22 minutes past 8 on LBC. You can watch us on the LBC YouTube channel, Facebook page or Twitter feed. Nadhim Zahawi is with me, the Minister for Vaccine Deployment, taking your calls. Javid is in Poplar. Hi, Javid. What would you like to ask?
Hello, yes. Good evening, Ian. Good evening, Minister. I'd just like to ask the Minister, me being of South Asian extraction and other minorities are highly susceptible to COVID-19 and risk of death. Why were we not placed on the priority list, please?
Good evening, Javed. You're absolutely right. And in category 6, which is the one we've just entered now, 5 and 6, number 6 is where people are 16 years old up to 65 years old who have underlying health conditions, including, for example, diabetes, which I know certainly from my family, but a lot of South Asian families suffer from or have family members who suffer from diabetes. So they will be covered in this phase 1, who are the most critical. But Javed, the Joint Committee on Vaccination and Immunisation, the scientists looked at the ethnic background of different people, and they looked at all the evidence, including different communities, and they fell very clearly on the side of the 1 to 9 categories, which is the over 80s. Of course, the top category was the residents of care homes and those who look after them, which we offered the vaccines to by the end of January for the residents of care homes. Then the over 80s and healthcare and social care staff, and then the over 75s and the over 70s and the clinically extremely vulnerable were in cohort 4. So if you're clinically extremely vulnerable, you would have had the jab or the first dose already. And then 5 is the over 65s. And then the 6, which is 16 to 65 years old, where if you have any underlying health condition, you will be given the vaccine now. And then we go 7, 8, and 9. And then we move into phase 2, where we're going to go back to the scientists, to the clinicians to advise us on who should be in phase 2 as well.
But given that we knew before the vaccination programme was even thought of that people from a BAME background were less likely to want to be vaccinated for all sorts of different historical reasons, which you'll be aware of, isn't that reason enough to maybe sort of bump them up the priority list, particularly maybe in the next round?
Well, so again, the JCVI, the Joint Committee on Vaccination and Immunisation, will look at all of that, Ian, and will advise us. We have I think, a really good uptake strategy for all different communities. I was in Hackney with Diane Abbott on Saturday night.
Because you know how to live.
Observing the vaccination program brilliantly delivered by the Hatsola ambulance first responders, very much part of the Hasidic Jewish community, doing an amazing job, not just for that community, but for Muslims in Hackney and others. They did 364 vaccinations in the evening, which was really great to see, very much part of the community. We have a full uptake strategy working with local government. We put £23 million into that to identify community champions, faith leaders in mosques, the Abbas Mosque in Birmingham, the Hekma Centre in Batley, in East London Mosque, where my good friend Rushnara Ali sent me some incredible evidence of the work they've been doing there to get the community, the Bangladeshi community as well, to be vaccinated. So a lot of work on the uptake strategy. We're going to see more work on this as well.
But you must be concerned by the figures that were released today. I think from the biggest hospital in Leicester, only 36% of their black employees had taken the vaccine. I think the figure for Asians was something like 54%, so still quite low. That has to concern you, particularly in the healthcare sector. And then we hear that there are still 30% of social care workers, some of whom, not all will be from BAME backgrounds, that they still haven't had the vaccine. That's got to be a concern.
Very much so, Ian, which is why we're spending so much time. I've put a lot of resource and effort into this. The NHS has this as a standing item every single morning on our operations call in terms of looking at the breakdown. We now collect ethnicity data and publish it every week. The good news is we're beginning to see an uptake more from the social care workers. On Saturday, I was looking at the national booking system, and out of 264,000 bookings, 91,000 were from social care workers. some of the evidence we've found is that it's about accessibility. People work shift patterns. People in care homes, for example, we're going back 4 times, so that twice for the first dose, twice for the second dose. So the more that it's accessible to them, the more people actually take up the offer of a vaccine. And of course, we have a communication strategy that is very much targeted at different communities, including those role models that they trust, whether it's doctors and nurses from their community or faith leaders. There's a big effort, big strategy that I launched on Saturday.
Okay, quick response from you, Javid.
Yes, thank you, Minister, for answering my question. I'm actually 62. I am type 2 diabetic. And any idea roughly when I may be called up to have my vaccination? And finally, a knighthood for Brigadier Prosser.
I think that would be something that certainly Her Majesty the Queen will look at. There, Phil Prosser has been incredible. Who is he? So Phil Prosser is the commander of 101 Logistics Brigade that would deliver all sorts of everything that the British Army, our armed forces need in Afghanistan or in Iraq or elsewhere. And he has been integrated, and his team, into the vaccine deployment program. He did an interview this morning with LBC with Nick Ferrari. It is a must watch. If you go on my social media or his social media, you'll see it. Humble, passionate, determined, focused, everything that is great about our armed forces in this country. And I'm grateful to you, Javid, for recommending him for an honour. There are so many people in the team. Emily Lawson, who's the senior responsible officer.
Okay, well, we can't go through all of them, the team. But just very quickly, can Javid expect a call very soon?
Yes, Javid, absolutely. Your GP, your primary care network, have you on their list, and you'll be called. I mean, now because you are now in category 6, which we are making sure that primary care focuses on to deliver. There's about that's a big category. There's about 6 million people who are 16 to 65 years old who have underlying health conditions like yours with diabetes, who are going to be getting the call, as well as those who are unpaid carers and carers overall.
Javid, thank you very much for that. We have an allied question to that next, but we'll go to the news headlines first. It's 8:30. It's 8:34 on LBC. Nadhim Zahawi is with me, Minister for Vaccine Deployment, Conservative MP for Stratford-upon-Avon. He's taking your calls on the vaccine. Abida is in Redbridge, a new caller. Good evening, Abida. What would you like to ask?
Thank you. Good evening. It's not a question, but I just wanted to point out that in April it will be Ramadan, and a lot of Muslims may not take up the injection.
Nadhim.
Abina, you're quite right. We've got lots of faith festivals. When I was with the Hasidic community on Saturday night, we were talking about Purim, which is coming up as well. Ramadan is coming up, and we've got to make sure we make plans for this, including working with faith leaders to communicate that it's right to take the vaccine and it protects you. It's all the sort of myth-busting stuff that the tsunami of misinformation that's out there. We're trying to combat, working with faith leaders and making accommodation, obviously, for Ramadan after people break fast, to be able to then get vaccinated. So we've had a tremendous response from people wanting to be vaccinated in places where, places of worship, like the Abbas Mosque in Birmingham or the East London Mosque, or cathedrals or gurdwaras and temples and elsewhere. We've got another 200 have applied to come on board, and we're assessing those as well, because people want to feel that they trust not just the voice and the individual that's telling them they should have the vaccine, but also the place they want to go and feel comfortable. And so we're working on all of that, Abina, and I want you to rest assured that we will accommodate, whether it's Ramadan or anything else, to make sure we vaccinate every community.
Abida, thank you. Let's move on to Bessie in Ashford. Bessie, what would you like to ask?
Good evening, Minister. Good evening, Ian.
Hi.
I am 83. I am disabled with very severe arthritis and Parkinson's. And what I would like to ask you, Minister, is why haven't I had my vaccination yet? We have had an awful job. Each time I'm told that I'm on a list. Well, on the 1st of February, suddenly I was taken into hospital and a serious kidney operation, and I have to go back again. Well, when I was in there, one of the doctors was horrified to know that I hadn't had my vaccination, and also I should have it before I go back in now. So I'm extremely worried about that. And I just wondered if perhaps on the next round that vulnerable people could be considered, not first or whatever, but just so that they get a little bit of care. We've made lots of phone calls and I still can't get my vaccination.
Is that because you can't go to the vaccination centre, Bessie? Would they need to come to you?
Yes, and my daughter's a carer, and
right.
She has a 99-year-old gentleman, and he had his vaccination at home 3 weeks ago.
Nadhim, this is a common thing that I hear from callers, particularly people who are housebound. How can they be sure that they will get their vaccinations?
So, Bessie, your primary care network, so that your GP, Bessie, will make sure that they come to you and vaccinate you. So we have, because you are in the top 4 cohorts where your GP, and I apologise if for whatever reason it hasn't happened yet. I don't know the details of your condition, your clinical condition, but you are in the top 4 category. And if you can leave me your number, your contact after this call, I will make sure I look into it, because you should have had a visit from your GP because you're housebound. You are in that top 4 category. And of course, you're clinically extremely vulnerable and you're over 80, Bessie. So unless there was a clinical reason linked to your operation that you've had where they couldn't vaccinate you, I will look into that, Bessie, and I promise you we'll get this sorted out.
I mean, that's good of you to offer that, but what about all of the other people that phone in whenever we do this kind of phone in, say they're in a similar position to Bessie? What should they do? Because there is, I mean, it's all anecdotal. That's the problem. It can only ever be anecdotal. But people who are housebound feel as if they're being a bit ignored.
Well, they shouldn't be. So to meet the target for today, all primary care networks who've been, I have to say, have done an incredible job at getting into both care homes and with the housebound patients on their list, were asked to confirm that they've offered the vaccination to everybody on their register, on their patient list. And they came back and confirmed that to the NHS. If people have, for whatever reason, not had that, then it's important that we find out. And I guess what I'm saying to your listeners is, if you are one of those people, please get in touch with your GP. If you don't get anywhere with your GP, call the NHS 119 number and we will get this sorted. We will get you looked after. But the GP networks have been brilliant at going out and actually vaccinating those who are housebound.
And contact your MP if all else fails, I guess. Bessie, thank you very much for your call. Helen is in Barnet. Helen, what's your question, please? Hi.
Hi, honoured to talk to you both. Nadhim, are you willing to share how many vaccines with vulnerable people in other countries before or after we've done all our priority groups?
Helen, good evening. Absolutely.
Hi.
So we're doing 2 things, Helen. One, we've contributed 500 million to the COVAX initiative, which is delivering vaccines to low-income and middle-income countries. And we're going further with a bigger initiative on vaccinations, which, if you remember last year, the Prime Minister held a big fundraising conference in London where we raised 8.8 billion for those countries. But then also with our own programme, my priority is to make sure I vaccinate the UK adult population as quickly as we can. And then if there are any excess doses, we will look at how we make those excess doses available to other countries. But of course, yes, we have, on order over 400 million doses, but that's not what's been delivered. A number of those are still going through their phase 3 trials. And of course, a number of those are going through the manufacturing process to make sure that they begin deliveries for us later in the spring.
But in terms of the COVAX scheme, how many doses have actually been delivered to poor countries up to now? Because, again, all that you read is that the scheme is there, it's well funded, but the vaccines haven't actually gone out yet in any meaningful numbers.
So the one that I do know, because I was talking to the chief executive about this over the weekend, Pascal Soriot of Oxford AstraZeneca, where the vaccine is being made available at cost whilst the pandemic is with the whole world, that now that the WHO have approved the Oxford AstraZeneca vaccine for use for all adults, they're doing 20 million, I think, this month and 20 million next month into Africa, which is obviously a large number. And of course, Pfizer, throughout this journey and are working with them from the outset as part of the Vaccines Task Force, made it very clear that vaccine, equality, equanimity was important to them, and that they will continue to deliver through COVAX. So I know a number of countries, we're sharing knowledge with, for example, Kenya, on how to deploy Pfizer, which is obviously much more challenging because of the minus 70-degree cold chain movement, much easier with AstraZeneca, and of course other vaccines as they come along. But there's a massive effort to deliver through COVAX for the whole world. My priority has to be to vaccinate the UK adult population as quickly as we can. And as I say, we will obviously then look at excess doses beyond that.
Because in a way, we can't really relax all of the travel restrictions until the whole world's vaccinated, can we?
No one is safe until the whole world's safe. Absolutely right, Ian. I've been saying that for since I got this job. It's very important we focus obviously on protecting our people. The United Kingdom, those who are the most vulnerable in the top 4 cohorts, is 88% of mortality. The top 9 is 99% of mortality. So it's a race against death. And as Simon Stevens put it, it's probably 2 sprints and a marathon, because this sprint just finished with 15 million. Next sprint is to get up to 32 million. Okay. And then marathon of revaccinating or boosting it in the autumn.
Right, Sarah in New Cross has sent a text in. Will supply increase or stay steady in the coming weeks?
Supply will increase, Sarah. We're seeing that already. It was in any manufacturing process, and I'm a chemical engineer, not a biologist, but I can tell you that even with vaccines, Sir Patrick Vallance, the Chief Scientific Advisor, will tell you there's never been a vaccination manufacturing process without its challenges. So it's lumpy, and they didn't get up to the levels that we expected in January of 2 million doses a week, for example, with AstraZeneca. They're getting close to that now in February, mid-February. So we should see much greater volume. I'm expecting tens of millions of doses to come through in March and April.
And Phil in Hull says, The Athletic reports today that Premier League clubs have considered offering donations to the NHS in exchange for prioritising footballers and staff for the vaccine. Would something like that be considered?
So we have to prioritise those who are at highest clinical need, Patrick. It's important that we protect those who are at greatest danger of being hospitalised and dying from this virus. And of course, then we'll move on to phase 2. And of course, once we've done that, we will offer it out to all of the adult population of the United Kingdom and make it as accessible as possible, including using more pharmacy. At the moment, 98% of the countries within 10 miles of a vaccination site. I want people to be able to walk down to their local chemist, and we have a fantastic community pharmacy infrastructure in the UK, which are already over 200 of them are delivering the vaccination program, but there's over 10,000 that we could use. So I want convenience as well as, of course, accessibility, because that's how you get the UK adult population has the highest level of acceptability of positivity about vaccines. 89% of the adult population say that they will take a vaccine, and we've got to make that available.
So no, even if it meant a reward for NHS staff, because the donations could be distributed to them.
Well, I don't think there is any reward that would value somebody's life. If they're at the highest risk, we have to follow the clinical evidence, Ian, and that is by joint committee.
We'll come back to more calls to Nadhim in just a moment. You're listening to LBC. I'm Iain Dale. It's 8:47. It's 10 to 9 on LBC. We're talking to Nadhim Zahawi, the Minister for Vaccine Deployment. He's taking your calls. Ellie has called in from Jerusalem. Ellie, what would you like to ask?
Hi, I haven't been home for nearly 2 years due to COVID, and I haven't seen my elderly parents who live alone. I received the vaccine here in Israel, and I was planning on coming home in the next month or two. But now with this new law requiring 2 coronavirus tests that cost £250, it made it unfeasible for me as a student. So I was wondering when the government were going to be making an international passport or allowing me to come back after all this time.
The vexed issue of passports, Nadhim.
Ellie, good evening to you. Ellie, we are not planning to have passports or international passports. What we're looking at is to make sure that people can access their own personal vaccination records. And of course, you can do that already on the NHS app if you log on and look at your GP and get your history, because the GP will have your vaccination history. It's all held in the National Immunisation Vaccination System. But what we are looking at is if other countries, like, for example, with the yellow fever certificate, require people to show a certificate of a vaccination, so we can try and make it as easy as possible for people to have that certificate of their vaccination. And of course, people can now they have to have a pre-departure test, and then a test after 2 days and a test after 8 days of quarantine. If they're coming from a country of concern, a red country, then they have to, if they're residents in the UK or UK nationals, they have to quarantine in a hotel, otherwise they can't travel here. And of course, otherwise, if they're not from those countries, they can quarantine at home, but still have to have the 3 tests, pre-departure, 2 days after, and then after 8 days of arrival.
Do you accept, though, that the messaging on these vaccine passports has not been entirely consistent from the government, where you said last week that you weren't looking at vaccine passports, and then Dominic Raab on Sunday to my colleague Tom Swarbrick in the studio said that you were. Boris Johnson said today that you're not, that you've been consistent on this, but why isn't the message getting through to your colleagues in Cabinet?
No, I think actually sometimes people have different interpretations of what it means to have a vaccine passport. If we're talking about vaccine certificates, where some countries will, as the Prime Minister has said, they may require them to travel to those countries, then we want to make those accessible to the individual.
No, but Dominic Raab was talking about shops or restaurants requiring evidence that you've had a vaccine before you can come through their doors.
No, that's not what we are looking to do. I think what you, as the Prime Minister has said, you'll find will happen is these rapid testing technologies, where, like with the pre-departure test, if you're able to have rapid testing, because that's the most reliable way of knowing if somebody has got COVID. Of course, we don't yet know the impact of the vaccination program on transmission or, of course, on infection. Now, the early data from Israel is really positive. Some of the early data from the Oxford team is really positive. But until we have our own Public Health England reliable data from the 2 big surveys that they're carrying out, one with frontline health workers, one with people, residents in care homes, we don't know the impact of the vaccines on transmission yet. So it would be, I think, wrong to assume that the best thing is testing at the moment. And I think the Prime Minister is right. The future will probably be around rapid testing, as well as a national vaccination programme, and probably a revaccination programme in the way we do flu vaccines every year.
But the Telegraph have just posted a story literally 34 minutes ago saying that UK cinemas have become striking deals to use vaccine passports that could allow them to reopen their doors to those who've already received a COVID-19 jab. Now, is that something the government's going to try and stop, or do you think, well, that's a private sector decision, they can do what they like?
Well, all I would say, one, it's obviously a private sector decision, but we don't yet know the impact on transmission of being vaccinated. So, the cinemas need to think that through. If you don't know whether the individual who's been vaccinated, can still transmit the virus, then it does slightly make it problematic for that particular headline or that particular idea. Much better to look at rapid testing. That, for example, a lot of employers are now using. We're being tested twice a week in Parliament with the lateral flow tests. The NHS workers have been doing it for months now. And of course, residential care home workers have also been doing that rapid testing. And we're making it available through local government as well to small business. We've just announced that we make it available to businesses of 50 employees. It was only available to larger businesses earlier on. So I think rapid testing is a much better way, of course, combined with a national vaccination programme that we will carry on delivering.
Right, let's go to John in Mill Hill. Hello, John.
Hi, Iain. How are you?
Hi. All right, thank you. What would you like to ask?
Good. Mr. Zahawi, I want to just quickly ask you about a recent press release which I saw yesterday about the wastage which occurs at the end of the day when the vaccination centres have finished vaccinating all their booked appointments and they still have vaccinations left over. I noticed that there's about 90,000 doses which went to waste about it. I wanted to ask the Minister, A, what's he planning to do about it? And B, if he's looking for solutions, because I think I may have one for him.
Thank you very much, John. So, obviously, if there's human error, then there will be some wastage. But the NHS absolutely makes it clear to everybody who is vaccinating across the whole of the infrastructure that they should not be wasting a single drop of vaccine. That is my message to everybody. They should have backup lists of obviously people that they can vaccinate at the end of the day from those cohorts, those priority lists from the JCVI, the Joint Committee, the obviously 1 to 4 up till now 5 and 6, and of course as we move on to 7, 8 and 9, and so there should be no wastage if people have vaccine. At the end of the day, they should be inviting those people to come in as a backup list. Initially, one of the ideas that we want people to have is have their local care home on speed dial to get the care workers in quickly, because the more accessibility, more access we give them to the vaccine, the more people are being vaccinated who work in social care as well as healthcare.
OK, John, thank you for that. Nadhim, earlier in the evening, I spoke to the Shadow Health Secretary, John Ashworth, and he was being so good. I asked him if he'd like to ask you a question. Here it is.
2 weeks ago, I watched It's a Sin. I binge-watched it. I was in absolute tears. And the stigma that we saw in It's a Sin means that there are still people today living with HIV who haven't and don't want to declare that to their GP. That means that they won't necessarily be invited in for a vaccination in this next phase. Why can't people living with HIV get their vaccination at the HIV clinic where they usually go to manage their HIV? I think I asked the Minister this a couple of weeks ago. He said he was looking at it. It's 2 weeks later. Can he now assure us and the Terence Higgins Trust, who are campaigning on this, that he has fixed this so people living with HIV can just go to the HIV clinic for a vaccination?
Sounds reasonable.
very reasonable and totally understandable, and we are looking at this. And I know some of our teams in the Northwest have found a solution to. We're trying to work with HIV clinics to make sure that people who, for whatever reason, don't want to go through their GP or the current deployment infrastructure, that we could go to them in HIV clinics and do that. It's a really reasonable ask, and we are looking at it very seriously, and we'll have a solution in place.
Final call from Adam in Manchester. Adam, you want to ask about a subject that I've seen a lot of chit-chat around on Twitter today. Go ahead.
Hello, Ian. Yes, I'll be brief. I just wondered whether the rules have changed around people with asthma. I was told throughout the pandemic by Asthma UK that I would fall into Group 6 with people with underlying health conditions, but it seems to be reported on the news today that asthmatics will only come into Group 6 if they've ever been hospitalised with the condition, and it seems to be a very late change. I wonder if the Minister could clarify the situation for asthmatics.
Thank you very much. So asthma is in Group 6, and of course it's a clinical decision for the GP. It's serious respiratory disease, including asthma. Within that, people on obviously inhalers. Then it is a clinical decision by the GP for those serious asthmatics, but they are in Group 6.
So just, if you're classed as an asthmatic, if you have an inhaler, is that enough to put you in Group 6? Or, as Adam says, do you actually have to have a more serious side to it?
No, if you have to have an inhaler and you are asthmatic, then you are in Group 6.
Right. Adam?
Yeah, that's really good to hear, Ian. And I two inhalers a day, winter flu jab, annual review with the nurse and all that kind of thing. But it just seemed to be today that you had to be hospitalised. So that's good to hear that from the Minister. Thanks very much.
OK, thank you very much for your call. And Nadhim, thank you for spending over an hour with us now. We're really grateful to you. Enjoy the rest of your evening. And we will continue the conversation in a moment on LBC. I'm Iain Dale.